Okay, viewers, you're welcome to the show again. Today, I want to talk about something very, very common, often not a sign of something serious, but can be very annoying. Today, we'll talk about a health condition called constipation. Today, we'll talk about constipation. In this lesson, we are going to learn the meaning of constipation. We are going to learn causes of constipation. We are going to look at symptoms of constipation, and we are going to learn how constipation is managed or treated. Okay, are you ready? Okay, let's begin. Have you ever been to the toilet and you struggle to pass out stool? That you find it difficult releasing stool? Yes, that is constipation. Constipation simply means difficulty in passing out stool. It's very common and can be very annoying. It's often not a sign of something serious, but can be very annoying. In rare cases, it may be a sign of something very, very serious, but oftentimes it is not a sign of something very serious. Okay, so what actually causes constipation? Okay, but before we talk about constipation, let's talk about the alimentary canal and the mechanism of bowel movement in the body. There are several organs that make up the alimentary canal. By alimentary canal, I mean all the organs through which food passes in the body. Okay, when we eat, the food goes from our mouth down to the small intestine where absorption of food takes place. Okay, so the body absorbs some useful nutrient from the food, but the unabsorbed food will be moved from the small intestine to the large intestine, also known as colon. Now, the large intestine is divided into three parts. We have the ascending colon, we have the transverse colon, and we have the descending colon. The unabsorbed food materials will be moved from the small intestine to the large intestine. First of all, it moves from the small intestine to the ascending colon, from the ascending colon to the transverse colon, from the transverse colon to the descending colon, from the descending colon to the rectum, and finally out of the body through the anus. Okay, so what actually brings about removal of feces from the body? Feces is removed from the body through the contraction of the colon walls. So the contraction of the bowel wall or the colon wall leads to the movement of feces from the ascending colon to the transverse colon, from the transverse colon to the descending colon. Okay, so constipation occurs when the movement or the flow of feces through the colon becomes slow. Now, when this happens, the body or the colon absorbs water from the feces, thereby making it hard. Yes. So when the movement of feces or when bowel movement becomes slow, it makes the body to remove water or increases the rate at which water is being absorbed from the feces, thereby making it hard. Yes, that's actually what brings about constipation. Now, what are the symptoms of constipation? There are so many symptoms of constipation depending on the cause and also depending on individuals. Different individuals may experience different symptoms. But the major symptoms of constipation are number one, finding it difficult to pass out stool. That's really, or sometimes releasing just small hard stool, or having a feeling that the bowel is not emptying, or having a feeling that the rectum is blocked. Okay, that can also be a symptom. And of course, bloating can also be a symptom. Bloating simply means having kind of swollen abdomen as a result of feces not being removed. And some persons may also experience abdominal pain. Yeah, sometimes abdominal pain can also be a sign. Also, sometimes pain during defecation. So some persons may also experience pain during defecation. And sometimes constipation may not show any visible sign. Okay, so these are the symptoms of constipation. Now, what are the actual causes of constipation? What actually causes constipation? There are so many things that can cause constipation. So we're going to look at some of them. Now, one of the things that causes constipation may be lack of fiber in the diet. What do I mean by fiber? Fiber are some of the things we eat that form bulk of the components of the large intestine. Yes, they are actually gotten from roughages. Fiber can majorly be gotten from fruits and vegetables. Vegetables such as fluted pumpkin, banana, avocado, whole grain, nuts. Yeah, these are some examples of food rich in fiber. So what does the fiber really do? Fiber form bulk of the intestinal material and enables the body to form feces easily. So not taking enough fiber might also cause constipation. Okay, another thing that can cause constipation is dehydration. Dehydration simply means not taking in enough water as you should. So not taking in enough water may cause dehydration as water helps to make feces softer. Okay, so dehydration is one cause of constipation. Another thing that can cause constipation might be bowel diseases like irritable bowel disease, IBS, Crohn disease. Yes, Crohn disease and IBS can actually cause constipation. In fact, IBS is one major cause of constipation. By IBS, I mean irritable bowel disease, and the cause of IBS is not well known. So many persons suffer from irritable bowel disease. I think about one fourth of the population suffer from irritable bowel disease. Okay, so irritable bowel disease is also one factor that can cause constipation. Now, another thing that can cause constipation is lack of exercise. Of course, movement or the flow of feces in the body is brought about by contraction of stomach walls, and physical exercise improves or make this movement easier. Okay, so when we don't engage in physical exercise, it makes the passage of stool difficult. Now, another thing that can cause constipation is stress or depression. Yes, stress or depression can lead to what we call slow gut movement. If a woman loses her husband today, the brain is aware that the woman will not have appetite to eat. So because of that, the food the woman ate before the news came will not even move faster. That's slow gut movement. That's the sympathetic nervous system taking over from the parasympathetic nervous system. So stress and depression can lead to slow gut movement. Constipation can also be an effect of other drugs. Yes, there are some drugs that may have constipation as their side effects. Drugs like pain relief, diabetic drugs, diuretics, that's drugs that take out water from the body, might also present constipation as a side effect. Okay, we also have some other diseases that can lead to constipation. Diseases that affect the nerves, like multiple sclerosis, Parkinson's disease, nerve problems, or sometimes neurological diseases can also affect the nerve that connects the brain and the large intestine, thereby bringing about constipation. So these are some of the causes of constipation. Okay, so how can we actually prevent constipation? Like I said earlier, oftentimes constipation is not a sign of something serious, but in rare cases, it can be a sign of something serious, like when there's an obstruction. Yes, an obstruction in the bowel can actually lead to constipation. And sometimes something I forgot to mention, and that's cancer. Cancer is a very rare cause of constipation, like colon cancer or rectum cancer can also lead to constipation. Okay, so how can we prevent constipation or how can we manage constipation? Now, there are so many ways we can manage constipation. One of them, or one of the ways by which we can manage constipation, is by eating food rich in fiber. Yes, fiber food makes uh, the body to make feces easier. So eating food rich in fiber makes or relieves constipation or even prevents what constipation. Like I said earlier, fruits like banana, pawpaw. Yes, pawpaw is a major fruit that helps constipation. So pawpaw, fluted pumpkin, commonly known as ugu in southern part of Nigeria, is also a vegetable that helps to relieve constipation. Another thing that can help in easing constipation is by staying hydrated. That's taking in as much water as possible, as much as having 8 glasses of water per day can also help to relieve constipation. Okay, another thing that can help to ease constipation is physical exercise. Exercise facilitates the movement of the colon walls, which bring about easy flow of feces through the colon. Okay, constipation can also be prevented by managing stress and depression. So when we try to manage stress and depression, we can also counter or tackle constipation. Okay, so how do we manage stress? We manage stress by getting a pet, playing with pets, getting involved in physical activities, going out, socializing with people. By doing this, we can actually ease stress. Constipation can also be managed by putting a stop to the drugs that causes constipation. But then you can only stop taking your drug when you're being advised to do so by your doctor. These are some home remedies that help to relieve constipation. But when home remedies fail, then we can resort to taking medicine. There are drugs that are saddled with the responsibility of inducing diarrhea, and these drugs are called laxatives. Laxatives enables the body to release stool by making the body to absorb water and inducing what? Diarrhea. Okay, so laxative helps the body to empty the bowel. So laxative should be an option if home remedies fail. Okay, so these are the ways to treat constipation. Okay, like I said earlier, constipation is common and it's not often a sign of something serious, meaning that you are not alone in it. But you need to see your doctor when you notice these signs I'm about to list here. Number one, when the constipation lasts longer than 3 days, then you need to see the doctor. And number two, when you are having severe abdominal pain associated with constipation, then you also need to see the doctor. Okay, so when you notice these changes, of course, you will need to see a doctor. Okay, so that's all for today. I hope you enjoyed our class. Till when next to me, thank you very much and God bless you.